Good morning, everybody. This is Tyler Finken, Health Marketing Director over at Western Marketing, coming at you with the first in a series of short educational videos designed to educate you on some basic insurance concepts, starting with Medicare 101 that can all be watched at your convenience. So without further ado, let's just jump right in. What are we going to cover today? Today we're going to cover what is Medicare, how to apply, what does Medicare cover, and what some of my options are. So let's start. What is Medicare? Medicare is a health insurance program for people 65 years of age and older, people that are under 65 with certain disabilities, and people with end-stage renal disease. Medicare is administered by CMS, which stands for the Centers for Medicare and Medicaid Services, and enrollment is done by the Social Security Administration or the Railroad Retirement Board. When can I apply for Medicare? Applications for Medicare can start 3 months before you turn 65. You do not have to be retired to apply for Medicare, and you would contact the Social Security Administration in order to get this handled. Enrollment is automatic if you have been receiving Social Security or Railroad retirement benefits. Now we're just going to go over kind of the basics of Medicare. Medicare is made up of 4 parts. Medicare Part A is what we call your hospital insurance in case you get admitted to the hospital. Part B is what we call your medical insurance, which you cover, physician services, stuff like that. Part C is what we call Medicare Advantage, which we'll get into at a later date. And Part D is prescription drug coverage. So let's go into a little bit more detail. Part A, like I said earlier, would be your inpatient hospital care, your skilled nursing care, your home health care, and your hospice care. Part B, your medical service, would include physician services and outpatient care, preventive services, diagnostic tests, some therapies, and durable medical equipment. Part C, Medicare Advantage, would actually replace original Medicare. Medicare Advantage must offer at least the same benefits that original Medicare does, but oftentimes they offer much, much more. And Part D, those would be your outpatient prescription drug plans. Now let's go into Part A a little bit more here. Most people receive Part A for free as long as they have been working for an equivalent of 40 quarters or 10 years. Now, for more information about Part A entitlement and if you would be entitled to a free Part A, you can call the Social Security Administration at 1-800-772-1213. Now, Medicare Part B is actually something that you must enroll in voluntarily. You will pay a monthly premium for Part B, which is $148.50 in the year of 2021, and that Part B premium might be higher for higher income individuals. How do you enroll in Medicare Part B? Well, you have the initial enrollment period, which lasts 7 months, including 3 months before you are eligible, the month you are eligible, and 3 months after you are eligible. Most times this goes off of your 65th birthday. You can also enroll in Medicare Part B during the general enrollment period, which lasts from January 1st through March 31st each year, which has an effective date of July 1st. Each year that you go without Part B that you are eligible, you could pay a premium penalty up to 10% for each 12-month period eligible that you are not enrolled. And this is paid for as long as the person has Part B, with some limited exceptions. Now, some people can delay enrolling in Part B with no penalty if they are continuously covered under an employer or a union group health plan. We do recommend this as people are working longer and longer nowadays. Now, they may become eligible for Medicare, but decide to delay their Part B due to being covered under their employer plan. So make sure that if you're enrolling in Part B, you discuss all your options with a licensed Medicare professional, find out what the best plan is for you. Now, when you do decide to retire after you've delayed your Part B, you will get a special enrollment period where you can sign up for Part B 6 months after your current coverage ends. How do you pay the Part B premium? Most people take the Part B premium out of their Social Security check. It can also be taken out of the Railroad Retirement or Federal Government Retirement Program. For more information on how to pay your Part B, you can call the Social Security Administration, the Railroad Retirement Board, or the Office of Personnel Management. If you do not want to make monthly payments out of one of those 3, you can get a quarterly direct bill, or you can check out Medicare Made Easy. Now, what are my choices in Medicare? You have original Medicare, which we just discussed, which is Parts A and B. You can supplement the Parts A and B with a Medicare supplement, also called a Medigap plan, which we will go into detail at a later video. You can have a Medicare Advantage plan, like we said, that replaces original Medicare. And you can have a Medicare prescription drug plan, which is required by law to have a Medicare prescription drug plan, or you might face a penalty. So, what is Original Medicare? We're going to go into a little bit more detail here. Original Medicare says that you can go to any healthcare provider that accepts Medicare assignment in the entire United States. What is Part A? Part A is your hospital insurance, like we discussed in previously on a previous slide. It has a $1,484 deductible. Now, you do pay $0 coinsurance if you go in the hospitals days 1 through 60, and are responsible for $371 coinsurance days 61 through 90, and more if you're in there for 90 more days, or more than 90 days. If you do go into a skilled nursing facility, you have a $0 day 1 through 20, and you are responsible for $185.50 days 21 through 100, and all costs for any days in a skilled nursing facility over 100. You can see how that would add up very, very quickly, and you may be in your best interest to check out a Medicare supplement plan. Part B operates a little bit differently. There's $148.50 monthly premium, which could be higher depending on higher income earners. You do have a $203 Part B deductible that must be met before Part B will pay out. And then after that, Part B covers roughly 8% of your bill, and you would be stuck with a 20% coinsurance after the deductible is met. Again, it might be in your best interest to get a Medicare supplement policy to help cover some of those costs, which we'll go over in a later video. This is the Medicare card. It's sometimes referred to as the red, white, and blue Medicare card, which makes it easy for seniors to remember. I would recommend them getting this laminated and keeping this in their wallet, purse, or whatever they have on them at all times, just in case. The Medicare card consists of their names and random alphanumeric characters that are used to ensure the safety and identity of the Medicare recipient, and the card looks like this below. That will do it for our Medicare 101 for today. I know we went over that very, very quickly. Would love to discuss it in more details with you. So if you do have any questions on Medicare 101 or what else it might cover, feel free to call us at Western Marketing at 800-852-7152, or email me there at tyler@𝗪𝘂𝘀𝘶.com. And we thank you for watching.